Really thrilled to be a part of this, this fantastic event, and looking forward to sharing our story with you. So, as Sridevi just said, I'm going to be talking about the work that we've been doing with Government of India on rural healthcare, transforming it through technology. So a little bit about myself. I used to code a long time ago. I worked at Sun Microsystems, Silicon Graphics, wrote a lot of programs in C++ and Java. And those days, Sun and SGI were like the Googles and Facebooks of today, right? And in fact, Google is using the same Sun campus that that I used to work in many couple of decades ago. And came back to India because I was really interested in social development. So we came back, my family, all of us moved back to India in the 2000s. And then I spent a decade just working on social development, with an organization called Janagraha. And then primarily I was the founder CEO of Arghyam, working on water and sanitation. After that, in 2013, I decided that I'd love to see how technology could be used to bring about social change and bring both my experiences back together, merge it together, and got this amazing opportunity at Dell, at Legacy EMC, which is now Dell. So the vision, the mission of Dell is to create technologies that drive human progress, right? Specifically, I am within the CSR team. And the CSR team has a 10-year vision called Progress Made Real. And that was launched like last year. In fact, the report for that has just come, the first report has come out this year. And that basically is looking at 4 pillars on how to bring about massive, large-scale impact, leveraging our technology, our people, and all the tools that we have available to us. So the 3 areas that we work in, for are advancing sustainability, cultivating inclusion, transforming lives, and upholding ethics and privacy. These are the 4 key pillars. The more interesting thing is that for 2030, we have a bunch of moonshot goals. And the one that you see circled in red is the one that I am involved in, and that's for transforming lives. And we have a goal to advance health, education, and economic opportunity initiatives to deliver enduring results to 1 billion people by 2030. Right? I'm really proud and happy to say that we are actively working on making this moonshot goal a reality through digital life care. That is the initiative that I'm leading here in Bangalore. It's a Dell Giving Social Impact Initiative. So I'm going to set a little bit of the context for you. If you look at our country of 1.3 billion people, right? Health is a very important critical issue. It's a social issue that impacts the lives of the 1.3 billion people. And frankly, now with COVID, I think health is getting its rightfully deserved spotlight, right? But some of the issues that maybe not everybody is very familiar with, 63 million people fall into medical poverty every year, right? And 1 in 10 suffers from an NCD. And medical poverty is basically families who were above the poverty line, but because of a medical issue in the family, they've fallen below the poverty line. And that's 63 million people, right? 1 in 5 suffers from an NCD. And I'm going to talk more about NCDs, non-communicable diseases. They cause 61% of the death and a huge loss to the economy, an estimated 4.5 trillion loss to the economy by 2030, right? So what are these NCDs? They are non-communicable diseases. Unlike, malaria, dengue, TB, leprosy, and all of these, diarrhea, diphtheria, hepatitis, these are all communicable diseases. Non-communicable diseases are cancers, hypertension, diabetes, heart disease, stroke, right? What makes them? These are the big disease burden for the entire country. And not just India, across the world, these are the big, this is the new big disease burden. What makes them particularly hard to handle are these 3 issues. One is they're silent. You don't really know that you have an NCD until it becomes fairly advanced. There are no symptoms, right? 50% of breast cancer cases in India are detected in the 3rd or 4th stage. And by the time the chances of 5-year survival rates are fairly low. They're in the single digits, right? That's one point. Second point, they're chronic, which means that unlike polio or malaria, you take your tablets, you're done, right? It's not like that. Once you're hypertensive for life, right? Which means, but the challenge there is that you also have to continuously manage your chronic disease. But in India, less than 20% of the hypertensives have their BP under control. And what that means is that they are at much higher risk for heart disease, stroke, and other conditions. And the third thing, which is least intuitive, is that NCDs impact the poor disproportionately. We tend to think of NCDs as a rich person's disease, urban lifestyle, we sit in front of computers, we're more, vulnerable to these. Not true. The poor who have born with lower birth weight, unfortunately have a higher propensity to get an NCD by the time they reach their 30s. So these three reasons make it a very important thing for government to address at a population level. So we are working with government, and I want to just explain to you, what does the government health system look like for delivery? Now, most of us are aware of, in a country like India, government provides the majority of the services, whether it's education or health or livelihoods, but a lot of us end up going to the private sector, right? And some of the challenges with the government, so first of all, in the government healthcare system, you have a fairly robust system that starts at the village level. So what you see at the bottom is that the ASHA workers, who are the village level workers, there are almost 1 million of them in the country, right? It's an army of health workers. And then at the next level, at the sub-health center, you have 200,000 health workers who are like nurses, right? The village workers have very little training. The nurses have about, 2 years of training. And then you have the primary health center, you have the MBBS doctors, the basic, general medicine kind of doctors. And then at the community hospitals, you have specialists. And finally, at the district and tertiary hospitals, you have the super specialists, right? So this is the entire hierarchy in the government. This is the government delivery system. So just some photos to show you what a primary health center, a sub-center looks like, and the health workers, right? This is the structure that all health programs, communicable, non-communicable, maternal child health, immunization, a host of services are delivered to the people across the country. Millions, hundreds of millions of people rely on these government services for their care. But unfortunately, there are a lot of challenges with the delivery of government services. Like I was just mentioning, many times you may not have the right number of staff, the positions might be vacant. The infrastructure may not be okay. You may not even have the hospital running properly. They may not have drugs. They may not have medicines to deliver. Sometimes there is lower accountability. So for all of these reasons, while the programs are designed to deliver really good quality care at a population level to the entire country, unfortunately, the quality of care, the access is not as good across the country, right? So our approach, when we started this initiative 6 years ago, it was to say, if the government wants to address NCDs, and if they have to strengthen this primary healthcare system, what you see here, right down at the villages level, right down at the sub-center level. And for that, the entire government system needs to work. So we started looking at how, if the country wants to get to universal healthcare and you want to strengthen the health system, and by the way, the same thing applies for education. It applies for any government delivery system. We started looking at how can technology play a role? Right? What is it that we can do? What are the challenges that they have today? And what is it that technology can do to improve the quality of delivery? And that was what we started building 6 years ago. So we're basically trying to bring about a digital transformation of government healthcare. So we're constantly, those of us working in the IT sector, in software companies, we're very used to the idea of digital transformation of airlines, banking, manufacturing, all of these sectors. We are trying to do that in the context of government healthcare, right? So let me tell you a little bit about first the Government NCD program. We talked about cancers, hypertension, diabetes, right? Government started under Ayushman Bharat, which many of you might have heard of. It's one of India's flagship programs. They've started a population-based NCD screening program. For all the reasons that I said, it makes it important to catch these diseases early and to be able to treat people so that it doesn't get to very adverse situations, right? So the government program is to screen everybody over the age of 30 and follow them through all levels of care so that we can actually ensure that they get treated for whatever condition they have, NCDs, right? So what we did was, if you look at all these bubbles, you know, the yellow, red, each of these is a government service provider. So we created a platform and a suite of apps for every single provider who's delivering care for this NCD program, right? So the village level ASHA worker, we created a mobile app for her. For the health worker, who's also called the ANM, we created a mobile app. For the medical officer at the primary health center, we created a web app, an administrator's portal, and dashboards. And all of these sit on the cloud. It's a cloud-based microservices, containers, you know, very, very cutting-edge technology solution with apps for all of them. And the idea is that every one of these individuals, the hundreds of millions of people who are going to be enrolled, we create a health record that sits on the cloud, and then through all these apps, we're able to update that person's health information and ensure through reminders, through, you know, alerts, ensure that the person gets the quality of care they need at every facility. So we know we make that these people now no longer have to deal with paper. They can enter the person's health record. They can refer the person to a doctor. The doctor can diagnose and give treatment, enter it into the app. The specialist can see the person's history, diagnose and treat them. The administrator can manage this entire thing. The health officials can see all this on dashboards. So the entire program is run digitally now. Right? I mean, that's the program that we built for Government of India. It's not quite digitally across the country yet. We're working on it, but it's reached a significant scale. Now, since this is a technology crowd, I wanted to share a little bit about the platform. It's a layered platform architecture, modular, open. We wanted to make sure we address all the issues of quality, productivity, and decision-making of the users. So on the topmost layer, we have apps for all the health users. And through APIs, they talk to the healthcare platform where we have health records, workflows, patient management, protocols and decision support, work plans, all of these modules. And at the lowest level, we have the infrastructure modules, the ID management, the data warehousing, security, authentication, role-based access control. So this entire thing is what we've built as a part of our digital life care offering to the Government of India. It's a CSR initiative. It's completely free for government. We've been working for in the last 2.5 years that we've been working with Government of India. Before that we worked with Andhra government, we worked with Telangana government, but in the last 2.5 years that we've been working with Government of India, 63+ million people have been enrolled across 26 states onto our platform. There are more than actually 35 to 40,000 active users. There are 6 apps, mobile apps in 10 languages, and we have a massive deployment team that we work with Tata Trust and the state governments using WhatsApp, using email, phone, field training to actually ensure that this deployment happens across the country. So this is probably not an exaggeration to say this is probably one of the largest digital health programs running in the country and probably in the world, just because it is population based and it applies to every individual over the age of 30. And so, as you can imagine, building technology that's going to serve such a large scale can be incredibly challenging. And but we are not doing this on our own. We work with a large ecosystem of partners of the Health Ministry of Health and Family Welfare. Some of the names you guys might recognize. NHSRC is a leading think tank that does all the policy guidelines for the Health Ministry. The All India Institute of Medical Sciences, we work in close partnership with them. The World Health Organization, the ICMR, all of these you would have seen in TV because of COVID times, but these are all leading health institutions that have helped us in the government guidelines and developing the application. Harvard University is helping us do a study of this across the country. Tata Trust is the field implementation partner. The National Informatics Center with the data center management. In the past, we've also worked with these organizations, with Andhra, Telangana, MIT, Sloan, Karuna Trust, IIMB, and the India Stack team. Right? So this is a large ecosystem. This is not just about a technology solution. It is very important to understand that it's not about just technology. It is really about, working with the ecosystem players to understand the actual pain points on the ground and devising technology that will solve that problem for the users, right? It has to be in the local language. It has to be user-friendly for the health worker. It has to work without connectivity because there is no connectivity in the rural areas, right? So we have to design a solution that works in the context, not designed for another country, not designed for another set of users. It has to be for this context. And that requires, all of us, frankly, have learned so much about public health just over this journey because we've had to understand the entire operations, what are the challenges and how to make it work through technology. And technology is not a silver bullet, by the way. This is just one part of a massive government program, right? This is just one small part. The program itself includes, the training of people on NCDs, new cadre of people who've been introduced into the system, the protocols, the medicines, the treatment, the diagnosis, all of that stuff. The technology is an enabler in helping this whole thing run smoothly. So these are just some screenshots to give you all a sense of the kind of tools that we've developed for the health worker. Like I said, while you're seeing it in English here, it's in 10 different languages. So most of them use it in their local language. Very little typing. They just click and point and changes colors and extremely intuitive for them to use. We have videos and a lot of ways that they can actually use these things to get support. Dashboards for health officials, drill down to the village level. So they get real time. So you can imagine all of this used to be a paper-based system. So some of the stories that I've heard is that a district official who's doing a monthly review with his entire team will end up, from each primary health center, he gets a stack of 50 sheets, right, of their progress for the month. And there are 200 people sitting in that room, and he has like these 50 sheets from, 50 different primary health centers. And he's supposed to review all of that and, try to figure out what is going wrong with the program and try to fix it, right? The health worker maintains about 40 registers, everything written on paper. And so when she's trying to cater to 5,000 people and she has to search for who needs the next follow-up, she has to go through these registers. I mean, that's not the way you can run a program like this, right? I mean, how is she supposed to deliver care for 5,000 people if she's going to keep going through registers, right? So that's why it's so important that when you're trying to do things at scale like this, technology, it plays an enormously powerful role. So some of the things that I wanted to share is that we have these reminders and these alerts. So let's say a person has been diagnosed with BP, right? High BP. And so the doctor, the health worker says, you have to go to the doctor, right? Now, does the person actually go? Remember, these are rural areas. People are not that aware. So if they don't actually go to that doctor for diagnosis and treatment, they might end up with very high BP and then unfortunately some much more, bad outcome, right? So our system will generate a alert for the health worker saying, this person was referred to the facility but did not reach the facility. Or this person was supposed to have gone for their monthly follow-up. They've already missed 3 of their follow-ups, and then it escalates that all the way to the highest level. So we have designed every one of these based on what are the problems that we know happen on the ground, and therefore what is the technology solution that can help them, right? And right here, the Government of India can log into these dashboards and they can drill down in real time. They don't have to wait for paper-based reports to come to them 3 months later, right? They can drill down to all the way down to the village level. They can say that, okay, what's going on in Madhya Pradesh? Let's drill down. Let's go down to the district. Now let's go further down to the primary health center, down to a village to understand what is going wrong, right? That's the power of dashboards that are driven by bottom-up data. These are just a bunch of photos from the field. One of the things I wanted to share, if you can see in some of these photos, these are my people from my team, Shweta from my team, Ramdas from my team, a bunch of people. The way we've always done it is saying we cannot sit inside our offices in Bangalore and try to design a solution for the field, right? So in the first year, I think we would have spent, I personally have trained more than 500 to 600 ANMs, health workers, over the last few years, right? Everybody in the team has gone to the field. And we actually spend time with them to understand how they're using it, what are their challenges. We've sat and trained, you can see these pictures, trained health workers. We've trained tons of doctors, and doctors are pretty hard, by the way. They don't like using technology. So that's always been the challenge. We've worked with government officials to design what is the kind of dashboard that would really work for them. And one of the things I wanted to also share is that because we're using is the reason why we've been able to go from, we started at one primary health center. The next year we went up to one district. The next year we went up to one state, and the following year to another state. And the year after that, in 2017, we came to Government of India. And that's because it's technology. So when you build it, it scales. The team is not that huge, but because we have built the technology and we keep ramping up the platform, making it more and more robust for scale and performance and security, but the core technology is scalable, right? So that's what you can bring. When you use technology to address problems of people, you get the power of scale, you get the power of performance, you get the power of replication, right? And by making it as a platform, you get the power of integration, of bringing the ability to innovate, to allow multiple people to develop apps on this platform, so that people can start developing custom apps. Somebody is very passionate about mental health, they can go develop an app for mental health, right? So this is the power of using a technology-based solution for addressing these issues. So I want to end with one of, we have lots of these stories of health workers who are doing these amazing things, once they get used to technology, right? So this is Preeti, and we want to empower India's Preetis, right? A little bit about Preeti. She's a mother of 2 teenagers. She's an ANM, and therefore she's helping 5,000 people in her catchment get adequate healthcare. She's living with an extended family who brings up her children. She's a small cog in the wheel, but she determines success or failure or good quality health for her area, right? The first time, so, Women Who Code, we're looking at this conference, right? But a lot of these women who are these health workers, they're all women, right? Many of them have never handled a tablet. They've never handled an app. So she was using her application for the first time, and now she's really comfortable. She loves the work plan, which reminds her of her action items. She didn't like the computer earlier, but many of them say now that, when they walk around in their villages, they get respect. People look at them because they're walking around with a tablet and they're, pulling up reports, right? So this is what we want to do. We want to be able to strengthen and empower health workers and be able to deliver care to the hundreds of millions of people across the country. Thank you.
Yeah, thank you, Sunita. That was a wonderful session on transformation of rural health, about the challenges in rural India, where there was low awareness of non-communicable diseases, and also about the digital life care platform, which will guide doctors and also offers recommended action. So it's just one example that how they have bring this machine to create this technology that drive the human progress. So Sunita, we have a couple of questions on chat. So the one question is, how can we contribute to healthcare system even at small scale and start at individual level?
If you're talking about through technology, and I can give the experience from Dell, I have a bunch of, really interested volunteers who come and who help us develop new innovations. They basically, these are pilots, but they're spending the time to understand the system and then developing apps for individual diseases. But there are lots of hackathons that go on, where people open up platforms for health. But the other thing I would say is that explore NGOs in your area. Many NGOs are trying to do remarkable work. See how you could help them digitize the work that they are trying to do and how they can use technology to help make a change. That's how we started. We started working with an NGO. So there are multiple ways that you can actually engage through your company, through NGOs, right? Through hackathons.
Yeah. Yeah. Wonderful answer, Sunita. So let's move on to the quiz. Sunita, can you please ask one quiz question to our audience?
Sure. So why are NCDs so difficult to manage? What is it unique about NCDs that makes it a tough problem to crack?
Yeah, please answer in the session chat.
Nice.
Yeah, so so we have noted down the winners and we'll be announcing at the end of the event. So following, we have like set of next sessions related to like big data. Speaker will be Manideepa, and on new development in capital markets, speaker. And we have Java Malagupta. So thank you once again, Sunita, for the session on most crucial issues that we are facing in India today. And thanks again to everyone who joined the session. Please hop into the next session. Have a great day. Innovative today for a better tomorrow.
Thank you so much for having me here. Bye-bye. Thank you.
Yeah, it was a pleasure. Yeah, bye.
Thank you. Bye.